Hello and welcome to ADHD Support Talk Radio. My name is Tara McGillicuddy and I am the host of ADHD Support Talk Radio. I'm an adult ADD and ADHD productivity coach, and I'm the founder and director of ADDclasses.com. And at ADDclasses.com, we provide virtual support and education to people affected by ADD and ADHD. We offer free webinars. We have an extensive ADD audio library with more than 175 hours of courses, and we also offer more in-depth support programs. You can learn more about ADDclasses.com and sign up for a free webinar by going to www.addclasses.com. And with that, I would like to welcome back Dr. Roberto Olivardia to ADHD Support Talk Radio. In just a moment, we're going to be talking about hoarding and ADHD. But before we begin talking, Dr. Olivardia, can you let our listeners know a bit about yourself and how they get in touch with you after listening to today's show?
Sure. It's always great to be here, Tara. My name is Dr. Roberto Olivardia. I'm a clinical instructor in the Department of Psychology at Harvard Medical School in Boston, and I have a private practice in a suburb of Boston called Lexington, where I specialize in the treatment of ADHD as well as Obsessive-Compulsive Disorder and eating disorders. And people can feel free to email me at Roberto, that's Roberto _Olivardia, which is Olivardia at hms.harvard.edu.
Okay, well, welcome back. You always talk about great stuff when you come on my show and do classes with me. And today we're talking about hoarding. So I guess the first thing that makes sense to talk about is what actually is hoarding? What is the definition of hoarding?
It's a good question. So when we refer to hoarding, we're talking about a situation where someone has acquired a lot of stuff, basically. It could be objects or things that are typically in their house, but people can hoard in their workplace as well. But also that acquisition is coupled with a failure to discard things. So it's a lot of addition without subtraction, and often to the point where it can be very interfering with one's life activities and can cause a certain level of distress either for that person or for people who live with that person or people who know and love that person. And a lot of times when I'm talking about life activities, it's the type of thing different than, let's say, somebody who might be a bit of a pack rat or just have a little clutter. People who are hoarders really have a hard time in terms of categorizing things and might end up having stuff, let's say, in rooms that are just not appropriate or outwards where it's very difficult to be mobile in their own home. And it's associated with a lot of health risks in terms of things like falling, fire hazards. It can exacerbate medical conditions in terms of the amount of dust of stuff for individuals who might hoard things like food, mold and fungus. It's associated with a lot of social isolation and depression. People who hoard often don't have people over their house, often will kind of disconnect themselves. So it's associated with a lot of significant risk.
Mm-hmm. So is hoarding related to ADHD?
Well, for years, Tara, it's interesting. With hoarding, it's been usually coupled under the obsessive-compulsive spectrum disorders as sort of an OCD-related illness. But research currently, and certainly clinical experience, if you talk to anyone who has worked with this population, as I do, that the current research is showing that actually one of the single most important or predominant traits of hoarders is executive dysfunction, that these are individuals who have major executive functioning deficits, which we know is very commonly associated with ADHD. Now, that's not to say that it's all ADHD, that there are individuals who sort of fall on this spectrum, but I work with a lot of people with ADHD who have hoarding issues, and it might appear differently than, let's say, what you might see on the show Hoarders, if anyone's ever seen that show. With a lot of my ADHD patients, they don't set out to hoard. I mean, they don't set out to sort of have all of this stuff in their house. It usually starts off perhaps with an impulsivity around shopping and kind of getting things, and they get bored. As we know, people with ADD might buy something, and then after a couple of weeks, they might get bored with it, and instead of discarding it appropriately or storing it appropriately, all of that takes executive function. And so when we think about it, to have a neat house, to be able to properly put away things, organize things, you have to have a certain level of executive functions. You have to know, do I need this? When will I need this? You have to make decisions. You have to determine what's the best place for this. Lots of my ADD patients hate the clutter that they live in, but they say, well, I'm afraid if I don't know what kind of categorization system to use. I don't know, so I just leave it all out. And that way, if it's, if it's in sight, it's in mind. If it's out of sight, it's going to be out of mind. What if I do need this? Now, what's different, ADHD related versus what you see in the sort of more OCD related, is my OCD related hoarders will say, what if I need this book? And if I throw it away or get rid of it, then it's going to cause me a lot of pain and anxiety, and it will be a bad thing. It will be immoral. It's often associated. It's often kind of creating a lot of sentimentality sometimes for these objects, so they're anxious about it. My ADD patients will say, well, what if I get rid of this book, and later I need it, and then I have to go through the whole process of finding another book, and they talk about it almost in this, like, the executive drain that might occur from that, as opposed to this panicked anxiety that you hear of, like, oh my gosh, my life will end if I get rid of this book. So you'll often hear about it in those ways, and a lot of times for people with ADD, they sometimes need things to get really bad before they feel motivated enough to kind of organize. But the problem is with hoarding is it just continues to get worse and worse, and then the overwhelm just gets more and more, so that you, instead of needing an hour to organize a space, you now need 12, and certainly no one with ADHD is going to say, oh, I'm motivated to organize for the next 12 hours, and it just becomes a just a bigger problem.
No, I know OCD and ADHD can often come together, coexisting. Is there a difference when the person has both of them?
That's a great question. Yeah, so 30% of people with OCD have ADHD. We don't know what percentage of people with ADHD have OCD, but they are actually more co-occurring than people might think they do, that they might actually co-occur. And that's something that anyone who works with hoarders should always wonder about if, let's say, it's someone who is diagnosed with OCD, whether there's ADHD also in the picture. And yes, typically you'll often find that as far as hoarding, that it increases the severity of the hoarding when someone has both, because it might mean that you have both sort of avenues of both the executive dysfunction as well as kind of this over-sentimentality. With OCD, you'll often hear of this sort of morality around objects. Like if I throw that, this is something that my mother gave me, and if I throw this away, I'm disrespecting her. And we're not talking about an heirloom. We could be talking about a greeting card, a happy 24th birthday generic card that your mom gave you, but throwing that away means you're disrespecting her. And that's sort of how people with the sort of more OCD-related thinking could be. So the ADD person might say, might not have any connection or sentimentality to that card, but just, I don't know, they'll sometimes say it's there and I know I should throw it away, but I just can't find myself motivated, to do that. Or if I want to keep it, because, I tell clients there's nothing wrong with saving certain things. I have tubs of, I call them like my mementos of myself or my kids, but they're in labeled tubs that are in my basement that are categorized, that are, put away, and they have their kind of own place. But yes, if someone has both OCD and ADHD, it can get tricky, and it's important to distinguish, is this sort of the more OCD-related thing where there's kind of this morality attached to discarding things, or is it more of an ADHD-related thing, especially where they're getting the things? That's often the first question, is how did you acquire all of these things? And a lot of times, again, with the ADHD people, it's, online shopping, flea markets, just these things. Like I had this patient who hoarded books, and he had ADHD, and he had every intention of reading these books. And, you know, I know my own experience. I love going into bookstores and getting books, and he'll say he'll be a chapter into it, and then he lost interest, and then the book but it did get he has a little OCD as well, and for him, he felt if he got rid of the book, then it would be almost this admission of failure that he wasn't able to follow through, which is kind of a script that he's had since he was a child with his ADHD, you know, being told that he's lazy, that he's not motivated. And so for him, it did carry this meaning of what it meant to actually get rid of books that he knows he'll never read. He has hundreds and hundreds and hundreds of books that he knows some of them are so outdated that it doesn't even, they're obsolete. But he said it would be an admission to him of engaging with those feelings. And I think that's very important when you're working with hoarders and understanding that there's a lot of, it's more than just the object itself. Mm-hmm. It's more than just, it runs a lot deeper than that.
Now, how does somebody get support, help, treatment for hoarding? Do they just hire a professional organizer to come in, or does it make more sense that they actually seek treatment from a mental health professional?
I would say it could be both. Now, typically with the more OCD-related hoarding, I would definitely say mental health professional, that professional organizers often do not have good success with the sort of more, because the more obsessive-compulsive hoarder tends to be a lot more cognitively rigid. They themselves actually don't report high degrees of distress. It's people around them that do. I mean, when I get calls from around those kind of individuals, it's usually not from them. It's actually from their spouses, their children, or their family members that say, my father, brother, sister, mother has a problem with hoarding. Whereas if it's someone with more ADHD related, I'll often get the call from the individual themselves that says, I can't even think in my house. It's so cluttered. And if somebody could literally bulldoze the house and just build a new one, I would be fine with that. Mm-hmm. So there's actually more openness and flexibility with the more ADHD-related hoarder who actually can respond very well to professional organizers. It is important for that professional organizer, though, to have knowledge of ADHD, certainly, and to have a real understanding of how this process works, because I worked with someone recently who in the past had used a professional organizer, and this organizer did not have knowledge of ADHD and assumed once they kind of cleaned up the area, everything would be fine, except within 3 months, the patient who had a compulsive shopping problem just filled up the apartment literally within 3 months, as if that work had never been done. Wow. And so in that case, that was someone who needed that professional organizer, but also could use mental health services because there was a real problem, a real shopping addiction that this person would engage in. So it's very important to assess sort of those kind of needs and severity, and I'll often recommend even having both, just almost as a team, just to make sure that all your bases are covered. Mm-hmm.
If somebody's like sitting in their house right now looking at all their clutter and junk, how do they know, or what might help them figure out, am I just a packer, is it just clutter, or could I actually be a hoarder?
Yeah, I would usually ask people, well, one, how much is it getting in the way of your life functioning? And what I mean by that is not just, I have clients who have stuff on their bed. I mean, they don't sleep in their bed. They sleep on their couch because there's so much stuff on their bed. Some of them have to take stuff out of their bathtub before they use the shower. Some of them can't cook because there's stuff that's just stored on top of stoves and ovens. But even aside from that, it's also even just to walk across a room. Do you have to walk over things? Could you walk through your apartment or your living space sort of in the dark without being at significant risk for falling? If there were, if God forbid there was a fire, in your house, would you expect your place to go up in flames very quickly because you just have that much stuff? But I usually ask people to ask themselves around the objects, let's say, that they have, if this thing broke, if this thing suddenly didn't work, would I immediately replace it, which would then suggest that it's something that you use every day. Like if my microwave oven broke, I would buy a new microwave within 2 days because I use a microwave a lot. But there are some other things in my house that if it broke, I might not, replace it right away. I may never replace it, and that would tell me I probably don't need this. I could get rid of it. If this was something I would ask patients or clients, is this something that you've used in the last year? When's the last time you've actually used it? Because what a lot of hoarders might say is, well, I might need that one day, or I might use that. I'll get around to it. I've been wanting to take up racquetballs, so that's why I bought the rackets and the equipment, so I'll get to it. But if it's been over a year where you've gone through every cycle, every season, the chances are statistically that you're not going to use it. If 1 year you haven't used something, unless there have been extenuating circumstances in your life, when you've gone through 12 calendar months, your chances of using it after a year are very, very slim. If, let's say, this is actually an interesting question I always ask people, if, hopefully this won't happen, if your house were on fire and you had a run-in and you could grab 10 items, what would those 10 items be? And that a lot of my ADD patients respond very well to that question, because as we know, for people with ADD, when the urgency is there, when the adrenaline is pumping, it's almost like our executive functions work best. And so that helps people realize, wow, these are, in fact, the things I really prioritize. And no, I'm not going to grab my report cards from fourth grade, as one of my patients has every piece of paper from school from his entire life, and he's 50 years old. And so he's not going to grab that because he never looks at it. Some of the paper is actually disintegrated in the boxes, so that's not going to be something he's going to get. That could be something that could be discarded. And if there are things that are good things, like when my children, as they're getting older, I'm very anti-clutter. And mainly, I would say, because of my ADHD, because I can't think in a cluttered space. It literally is such an executive distraction. So when my kids' toys, as they were getting older, some of them are very good toys. I don't throw them out, but I'll give them to a Salvation Army or, some a place that you can donate toys or things like that. And that makes people feel better that it's going to go to use in some ways, as opposed to just being thrown out.
Okay, now we're actually getting towards the end of today's show. Is there anything in relationship to hoarding and ADHD that you didn't share today that you'd like to share, Dr. Olivardia?
I would say, it's very, very important. The shame is huge with this population, and I just, for anyone out there who's listening to this who has this problem, please talk to somebody about it. There is support out there. You're not the only one. There are millions of people that deal with this, and it's a spectrum kind of issue. I mean, there are some people, I think a lot of times because of the show Hoarders, which has it's elevated the visibility of this problem, but it's also the more severe end. And I've worked with patients who think, oh, well, I'm not a hoarder because I'm not like that. I'm not that bad. And yet they're still feeling distressed, and they think, well, people are going to think I don't, that I shouldn't be getting treatment because it's not that bad. It's whatever is getting sort of in your way, not to have shame around it. It affects a lot more people than you think you do, and it's people that live right in your own neighborhood. I work with people of all different socioeconomic, classes, and people who live in these big mansions that are hoarders, and people just don't come in their house. And so treatment is effective, but it is scary a little bit for people. It means that you're engaging with a lot of emotion and, a lot of executive sort of functioning tasks. And I always tell people prepare. There's an acronym I use, like prepare for the race, which means R stands for some resistance that you're going to have. You're going to have some ambivalence about getting rid of things or knowing kind of how to organize them. C would be the conflict. You might have some conflict with whoever you're working with to do this, and E is the emotion. There's going to be a lot of emotion around it. And as long as you can kind of stay the course, you can open up your life in a way that these things won't get in your way.
Thank you. Thank you so much for telling people they don't need to be as extreme as the people on TV, because I think a lot of people do believe, oh, those people are so bad, I'm not that bad. But listening to what you're just talking about, I'm like, am I actually a hoarder? I never considered myself a hoarder, but I fall into some of these categories, and I'm definitely not as extreme as somebody who's, going on one of the shows like Hoarders, but it's something that in the past I've received support for and improved my life. So I want to thank you so much for clarifying that it doesn't have to be as extreme or as bad as the people who are in Hoarders.
Yes, thank you.
Okay,
Yes.
thank you. So before we get going today, Dr. Olivardia, could you make sure you give out your contact information?
Sure. People can feel free to email me. I don't have a Facebook or web page yet. My email is Roberto_Olivardia, which is OLIV as in Victor, ARD as in Daniel, IA, at hms.harvard.edu. And I welcome any comments, feedback, questions that people may have.
Thank you so much, Dr. Olivardia, and thank you everyone for taking the time to listen to ADHD Support Talk, and be sure to stop by our new website at ADHDSupportTalk.com.